So my day-to-day life as a patient experience navigator is rounding on patients, checking on them, making those connections, and making sure that everything's going well. We're kind of the bridge to everyone. We check on our patients, see what their concerns are, and connect them to who they need to be connected to.
Every patient has a story, and I think that's the unique thing about our job too, is that we have the opportunity to connect and listen to those stories, where other staff members, nurses and doctors and other ancillary departments do not have, because they have a small window. And then we get to share it with the nursing staff. Hey, did you know a patient in room 205? Did you know that they were an Army vet? Or did you know they lived in 6 other countries before coming here? Or they owned a boat, or whatever the case may be.
I feel like the most memorable moment from making those connections from patients is I had a really long conversation with a gentleman who flew for multiple presidents for Air Force One. And I feel if you don't sit and have those conversations and connections, I would never have found that out. So that is just so amazing.
We always want to provide that consistency, that friendly face to the patient. So we always want to make sure that they have the resources. And if they don't have that support, we want to make sure they're connected to the people who could support them, both inside the hospital and outside the hospital.
I always say I get about 20 seconds when I walk into a room to get their attention and a smile. And if I can get that part going, then I know I've done my job. But the act of checking in and saying, how are you doing? Is there anything I can get for you? Are you too cold? And if they say, no, I'm actually really good, but thank you so much for checking in on me, that to me is a big win, knowing that someone besides the medical care team came in and said, is there anything else I can do for you? What's that one more thing that we can do to bring you comfort?
When we connect with our patients, we're asking them, what do they want? What do they need in their care? And we're also helping them push to ask questions when they see their doctors and their nurses. So we want to get them involved in their care. So we have that unique opportunity to share the voices of our patients. We all play a role in the Sharp experience.